Thank you. So thanks for the introduction. I'm from Canada. My background is in general surgery. I'm currently a fourth-year resident. I've kind of done a fragmented half residency and half in pursuit of a PhD in community health and epidemiology. And today I'll be talking about one piece of that research, so understanding Saskatchewan women's choice of mastectomy versus breast conservation therapy in early stage breast cancer. So I'd like to thank my supervisors as well as everyone else who is involved in this research project. I have no disclosures to make. So we all know here that breast cancer affects a significant portion of our population. However, for early stage breast cancer, which we define as stage 1 or stage 2 breast cancer, we also know that survival, 5-year survival, is quite good. And with that early stage breast cancer, we also know that treatment between breast conservation therapy, being lumpectomy followed by 4 to 6 weeks of radiation, is equivalent to treatment of mastectomy. So in these kind of situations, generally what is done is, and I'm sure you guys have all gone through this, is you're offered the choice of either having a mastectomy or having breast conservation therapy. So in Canada, the Canadian Institute of Health Information and the Canadian Partnership Against Cancer released a report in 2013 looking at the Canadian stats from 2007 to 2010 inclusive. And we found a huge interprovincial variation between the mastectomy rates in the provinces. So I'm from Saskatchewan, and we had the second highest mastectomy rate in the country, being 65%, compared to the national average of 39%. So here's a map of Canada in case you're not familiar with our geography. Saskatchewan's here in the middle here. And so here's a table showing the distributions that we just talked about. We have the Canadian average here at 39%. And it goes as low as 26.5% in Quebec. And here we have Saskatchewan with a mastectomy rate of 65%. So quite significant interprovincial variations in rates. Oh shoot. Sorry, I hit the wrong button there. So the real question that comes out of that is, why are we seeing such significant differences? And coming out of the report at the end, they suggest examining clinical practices by provinces and territories to better understand how women are exercising their treatment options. And that's really what's led to my thesis work and trying to sort out this question here. So our study objectives here were to identify factors that influence Saskatchewan women's choice between breast conservation therapy and mastectomy, and to compare and contrast the underlying reasons behind the choice of mastectomy and breast conservation therapy. So this research project is quite different compared to some of the other talks earlier this morning. It's kind of the basic science stuff on one end. And here what we did was a qualitative research project. So qualitative research being looking at the words and the meanings behind interviews and what people say in comparison to looking at numbers. The qualitative methodology we employed was interpretive description, and we sampled our patients using purposeful sampling, trying to target patients in different age groups, trying to target patients who lived various distances from treatment centers, various ethnicities, as well as urban and rural locations. We did our recruitment in collaboration with the cancer agency. They mailed out letters to previous breast cancer patients, and they contacted us if they were willing to participate in interviews. Our initial goal was to have 10 mastectomy and 10 breast conservation therapy patients. In the end, we interviewed 13 mastectomy patients and 12 breast conservation therapy patients. We used a program to help facilitate some of our data management and analysis, and then our analysis followed what's termed thematic analysis by Bond and Clark. So I won't go into that in too much detail, but just to kind of give you an overview, what we do is we interviewed all our participants, and then we created this thematic index where we kind of categorized the main factors based on the words and descriptions of the participants themselves. And this went under a couple different iterations. And then we create what are called thematic maps, where we try to make deeper connections behind these factors. And then these go through a couple different iterations as well. So our final results are actually presented in these thematic maps. So first here we have the results presented for why we found women chose mastectomy. So there's 3 central reasons: worry about cancer recurrence, worry about consequences of breast conservation therapy treatment, and breast tumor size ratio. So that's for women who chose mastectomy. And for women who chose breast conservation therapy, we found that they chose that therapy option for 3 different reasons. Belief that mastectomy was too radical, surgeon influence, and the importance of feminine identity. So I'll go through each of these main themes here and try to expand a little bit and really support what our participants said with some quotes from our participants. So first, talking about why women chose mastectomy, one of the central themes was this strong worry about cancer recurrence. Now, what we found that was interesting in our study was this worry about cancer recurrence was always related to another secondary reason. So having a family history of breast cancer that was strong, wanting to avoid serial follow-up imaging, or knowing a close, confident, like a family member or a friend who's gone through breast conservation therapy and had suboptimal results, and so that's what caused them to worry. So here are some quotes to kind of illustrate what the participants thought. And just eliminating the risk, and I'm a worrier. And I would probably always be feeling my breast and think, oh no. I had known always, and I've said this for years, but if I ever had breast cancer, I would have a mastectomy. I don't believe in lumpectomy, and I don't believe in radiation treatments. I've had many friends who have had lumpectomy in the past, and they've all had cancer recurrence, and then had to have more surgery again. So I don't believe in lumpectomy. I always thought I would always get it all taken care of at once: the risk of recurrence and the fear of finding a lump again, and the fear of always checking. I would always be looking for a lump, and I didn't want that. So the next major theme women chose mastectomy was avoiding a consequence of breast conservation therapy treatment. So the possibility of requiring further surgery if you have lumpectomy is there. So some women really didn't want that. And then the other one was avoiding radiation therapy, because with lumpectomy, it's essentially mandatory to have that 4 to 6 week radiation treatment. Here are some quotes. I didn't like the idea of radiation. I work in the OR, and I've seen surgeons complain of radiated fields, so I did not want to have radiation. So that's the reason I chose mastectomy. I didn't want to also have it, but then, whoops, then need to have more surgery. The last main theme that we found that women chose mastectomy was because of breast to tumor size ratio. So the thought that, that the tumor they had was too large relative to their breasts, or that their breast size was small relative to the tumor size. Here are some quotes. I remember in my mind, lumpectomy was never an option. I was never considering it. Because of the size of the tumor, I just wanted the whole breast gone. And with lumpectomy, I wouldn't have been left with very much breast tissue anyways. My lump was too big, and my breasts are too small. So next we'll move on to the main themes we found women choosing breast conservation therapy. First one we'll talk about was this idea that mastectomy was felt to be too radical. And like with the worry about recurrence theme, we always found that women who felt mastectomy was too radical always felt this way for another underlying reason as well. So they felt that they had belief in breast conservation therapy. They thought this was a good therapy and it was going to work. They thought that recovery time for mastectomy might be too long, or they thought that the tumor size was so small that mastectomy was a radical choice for these patients. And here are some quotes. I think because there's less complications if I go that way, Also, I have a second chance to go that way if I have to. I have a firm belief that science has come so far over the years. Those things were encouraging for me. Because it had been so small, if it was massive, I would say, look, let's do something major. It was so small, why should I lose a whole breast? In my case, I didn't feel that way. If there was something wrong with my finger, I wouldn't chop off my whole arm. So I felt confident that it could be controlled or treated in a manner that was less severe for me. So the second important theme we found for women choosing breast conservation therapy was belief in their feminine identity and feeling whole and their body image associated with that. Here are some quotes. It's really important for me to maintain that female body form, so the image for me was huge for my self-esteem. Let's face it, if a woman loses a whole breast, it's quite traumatic. It's so much part of you being a woman, but with lumpectomy, I have one little scar that's about 3 inches long. For my own self-image, lumpectomy was easier to deal with. And then the last major theme was this surgeon influence, suggesting for people to have breast conservation therapy. And when asking patients why they thought the surgeons were influencing this way, it had to do with the tumor to breast size ratio was often what the patients reported. Here are some quotes. And of course he influenced it. He knows more about the area than I do. And when he said if it was his mother, he would recommend the lumpectomy. Even though you're a retired healthcare provider, it's different when you're on the other side of the fence. You don't think logically. It was mostly his recommendation to have the lumpectomy. He said since it was so small, he would suggest a lumpectomy. Thought you were the surgeon, you know what you're doing, so I agreed. So in summary, we have both thematic maps up for the reasons women chose mastectomy and the reasons women chose breast conservation therapy. We see that the themes and the underlying reasons for both choices are different between the two groups of therapies. And what was interesting with our study was that a lot of these have kind of been reported individually in the past in previous research, but this second area level of connection, that second level of influence hadn't really been talked about in the literature before. As well, these thematic maps, I think, are a nice aid for healthcare workers to kind of help them understand the complexity behind this, what's certainly a very difficult decision-making choice, and see all the potential different influences and reasons patients may make that choice. So this, just a little bit more about, I guess, my thesis research. This was the first piece of my research. We also did a systematic review, and then using this initial qualitative survey, interview results, we've built a survey that is currently being mailed out to about 1,000 previous patients in Saskatchewan. So I think, hoping with that data, which is maybe going to come in the next kind of 2 to 3 months, we're going to get a better idea of what exactly is happening in Saskatchewan and why women are making the choices that they do make. Okay. A couple limitations. This was retrospective, all in the past, so some potential recall bias. A couple of patients were excluded because they weren't sure, they couldn't remember if they were offered a choice of therapy or not. And of course, these were all patients in Saskatchewan. All right. Questions? So for us, our research is just going to be limited to Saskatchewan, just in terms of resources and feasibility. However, there are a couple other provinces also taking slightly different but similar studies looking at the same question. So I know Alberta is, and as well as Newfoundland. There are those numbers out there. I can't recall the exact number right now. Certainly, like when you look at that first graph I showed, there's a breakdown of what they call initial and final mastectomy rates, and that's usually exactly what you're talking about, you know, initially having a lumpectomy and then within a year going on to have mastectomy. So the numbers are out there, but I can't tell you what the numbers are. Yeah. Yes. Yeah, they weren't significant. It didn't explain the difference between the provinces, the differences in having subsequent mastectomy after initial lumpectomy, but there certainly were slight differences, but definitely not as drastic as we saw across the provinces yet.
Over here.
Just a question. Would the existence of more than one lump in a breast be regarded as a sub-theme? Is it extraordinary or is it not? How come it didn't come into this study?
You're talking about if you have like multiple. So that's it. So that's the treatment for if you have multifocal breast cancer is different than a single site, and so that gets a little more medically and surgically complicated, and so those patients sometimes don't quite have the same treatment options. They might not have the option to have lumpectomy and breast conservation therapy. So for our study, we're just focusing on that group of women who only have one foci of cancer. That does cover most patients with early stage breast cancer. Yes, the reason we can't include those patients is because the decision making for those patients aren't the same as just having the one foci of breast cancer. Yeah.
One final question, if anyone has one. Lady in the front here.
I too have been diagnosed with a mastectomy and reconstruction 8 years later, which is next month.
Okay.
I am going to have the other breast. What do you think? What's your option?
Pardon?
What's your recommendation?
Well, I think that's largely a patient choice factor, and I know it's having the other breast removed contralateral prophylactic mastectomy has really the rates of that have really increased over the past decade. Certainly in certainly in North America, I know, and that's a complicated kind of topic on its own, but largely for that it really comes down to patient preference, is my opinion.
Lovely. Thank you very much. Another big thank you to Dr. Jeffrey Gu from the University of Saskatchewan.